Hi, Dr. Ahmed with the Brain and Spine Institute. In this video, we're going to talk about a traditional lumbar fusion. Now, please keep in mind that these videos are meant for the patients being treated at this practice, and that these videos provide a generalization of what the surgery and outcomes may be like. The outcomes can vary patient to patient. A traditional lumbar fusion is performed with the patient laying face down. An incision is made in the middle part of the lower lumbar or low back region. Now, the length of the incision is really dependent on how many levels are being treated. Once the incision is made, dissection is made through the skin and muscles. Ultimately, the muscles are dissected off the spine and the spine is exposed. Once the spine is exposed, bone is removed in the area where the disease is taking place and where the nerve impingement is. By removing that bone, the surgeon can see the nerves in the center part and the nerves leaving the spine. By removing the surrounding tissue, that allows us to achieve a decompression and unpinching the nerve. The number of levels that are decompressed in the spine really depend on where the disease is in the patient. Once the decompression is complete, sometimes we have to put hardware in the spine, and that's called a lumbar fusion. The reason we have to put hardware in the spine is to provide stability to the spine. So that involves putting screws in the spine and then connecting them with a rod. The number of levels fused depends on the patient's disease and severity. One additional step the surgeon may take is the surgeon may decide to take the disc out. Sometimes that's done because the disc height has collapsed, or maybe the disc has degenerated enough to where it's not serving its purpose. So the surgeon will take the disc out and put a cage in between the vertebrae. That cage provides biomechanical support and allows the fusion to occur better. So once the fusion is complete, bone will regrow along the hardware, which is the screws and rods, and bone will grow along where the cage was placed. This provides superior mechanical stability to the construct. When the cage is placed, that is called a transforaminal lumbar interbody fusion, otherwise known as a TLIF. Here is a spine model representing a two-level lumbar fusion with interbodies. As you can see, the screws and rods are placed from the back side. They go all the way into the vertebrae, and the space where the disc was has been replaced with a cage. Depending on the number of levels being fused, the surgery may last anywhere from 2 to 5 hours. Certainly the 5-hour surgery would be the more complex version of this surgery. The patient will be in the hospital 2 to 3 days after surgery. The patient will have a back brace to wear when they are up and about. The patient will return to the office at 2 weeks where the incision will be checked, and then physical therapy will start. Physical therapy for this type of surgery can last up to 3 months. Patients start driving anywhere from 2 to 4 weeks after surgery, and the same goes for returning to work.